Senators from across the political divide are opposed to the National Executive's proposal to establish an advisory committee at the national level to manage primary health care. Debating the primary health care bill at the Turkana County Assembly, senators said the proposed primary health care advisory committee will create bottlenecks that will hamper service delivery by community health promoters. The lawmakers instead want more funds channeled to the counties to promote the implementation of primary health care.
The primary healthcare bill currently before the Senate seeks to establish primary healthcare networks at each county and sub-county level to ensure equitable distribution of resources and health services. In a bid to fast-track realization of universal health coverage, the National Executive is proposing creation of community health units of not more than 1,000 households each and community health committees to oversee the operations of the health units.
For someone like me who comes from a rural setup, this is going to be a huge initiative because look at the number of young people we are bringing into employment by hiring them as community health promoters.
Clause 14, Subclause 4 of the bill sets out the functions of proposed primary health care advisory committee, including advising the ministry and county governments on delivery of primary health care services and conduct periodic reviews on implementation of primary health care.
Mr. Speaker, I really want someone to convince me that I need a county advisory health board, and then at the same time I need a national one.
Mr. Speaker, we are in a country that we know that healthcare has been an issue of marginalization to communities since independence. And here, you have got a leeway where you're giving a national executive to further marginalized counties.
Senators opposing the creation of the National Advisory Committee argued it was unnecessary since implementation of the primary health care was done at the county level.
It cannot be, Mr. Speaker, sir, that we are standing here today talking about a health function that is devolved and at the same time saying that we are going to create a national body that will be governing or guiding the policy. Mr. Speaker, sir, we will be missing the point.
Please, let us not pass any law in this house that close back the gains of devolution. We cannot say that primary health care, which is a devolved function, is going now to be managed by people sitting in Nairobi calling themselves a council.
The draft law also establishes a county primary health care advisory committee mandated to ensure effective implementation of healthcare services through resource mobilization. If passed by the Senate, it will be referred to the National Assembly for concurrence before being forwarded to the President for assent. Vishoke Washira, Prime Edition.
Their counterparts